Hello, beautiful people. Welcome to Homeopathic Lighters. In this discussion, we discuss about tumor markers, which is coming as a 20 marks in your exam. So we discuss by dividing into 3 points, that is introduction, diagrammatic representation, then what are the examples of tumor markers, what are the additional markers. So introduction, we discuss definition of the tumor marker. So what is its definition? It is a type of chemical. Tumor marker is nothing but a chemical which making the tumors. As they making the tumor cell, so where during the cancer or a tumor period, they are found in a large concentration in the different body fluids like blood, plasma, serum, etc. So that is its definition. So what is its definition? Tumor markers are the type of chemical which are making the tumor cell. So they are found in a large concentration in different body fluids like blood, plasma during the cancer period. Now, why the tumor markers are important? Because it is used as a diagnosis and it becomes a supportive agent to diagnose a cancer. So it is also called as a surrogate marker. How we use this as a marker or a diagnosis, we discuss by a diagrammatic representation in the second point. Besides that, we should importantly note down that it is only diagnose or support the supporting agent to diagnosis the cancer. But what are the confirmatory diagnosis? That is biopsy or histochemistry, IHC, immunohistochemistry. These are the IHC or immunohistochemistry, immunohistochemistry. These are the confirmatory diagnosis of the cancer, whereas biomarkers are the supportive diagnosis. So how it is act as a diagnosis? Here you can see a graph between time and the level. So as increasing in time, here you can see the biomarkers get a slope down will be occur, and we can represent it as 1, 2, 3, 4. So we can represent it as 1, 2, 3, 4. Here you can see that when the biomarker is present inside the body in a high concentration, we call as a 1. So this is a suspecting diagnosis. Means when we diagnose a case of cancer, we first give the biomarkers level is more in that time. Then in second, the sloping period you can see which indicate the response therapy. Means the level of means if the level of a tumor is less or more, that makes the response of the therapy. Means how much level of a biomarker is present or its slope makes the tell us that what is the response of that biomarkers on that cancer. Means how much the level of biomarkers is present, we can suspect that if the biomarkers level is down, now we can suspect that the therapy is responsive. Then in third point that it is a constant. So here you can see after duration of a cancer free, here the level is down or decrease and become a constant line or a straight line, that it represents that in that period the cancer marker is low or not present, that makes the cancer tumor rate low or free, that is a remission period. So and the fourth is the if reoccurrence of the cancer. Means after therapeutic use surgery, but if the graph is now marker, we can see that it is rise again, then we call as a reoccurrence period. From this we can diagnose that if remission, that 3 is greater than 4, then we can call as a good prognosis. But if 4 is greater than 3, then it is a poor prognosis. That is the thing which sense from this our graph. Now we go towards the tumor marker having many categories according to their protein variety, hormone variety, or they may be oncofetal antigen variety. So there are many categories of a tumor marker is found. So how can we remember this variety of a tumor marker for different type of a tumor? So you can just understand and go line by line with me. So Ig marker, its name itself says that Ig is what? Immunoglobulin. Immunoglobulin is secreted from what? Plasma cell. So if immunoglobulin rise or a marker, it is a tumor marker for what? Plasma cell cancer. Okay. So that is multiple myeloma. You can understand how it is very easy, because as these terms are related to their source of origin, you can remember by recalling your physiology, biochemical knowledge. If you know that this marker or these things are coming from that thing, then you can understand that this cancer is related to this marker. So this is very easy. Then PSA. PSA means prostate. PSA, its name is itself says that prostatic cancer assay, means prostate cancer. That is a protein type of a. Now we go towards the hormone tumor marker, that is HCG. HCG, we know HCG is secreted from what? Tropoblastic cell. In the physiology, you know it very well. So HCG is two types. What is what? One is alpha, another is beta. So we know from this HCG, you break down the term HCG. H for hyper, means increased secretion. Increased secretion of HCG. C for choriocarcinoma. Choriocarcinoma, which is found in the chorion. Chorion is present in which time? That is the gestational type of the fetus. So in the gestational tumor, that is choriocarcinoma, at that time the HCG level is increased. So just break down the term. It is very easy. You can remember the markers with its cancer name. So G for germ cell cancer. So HCG, what we find? That hypersecretion of HCG means high HCG level. The cancer, which is C for choriocarcinoma and G for germ cell carcinoma. And HCG, the type beta HCG is important. You should remember that beta HCG, which is the important HCG, which related in the this beta HCG is the important HCG which is related to this tumor. So alpha do not have any do not have any role on a tumor. Only beta part of the HCG is related into choriocarcinoma and the germ cell tumor. And how? Because C for choriocarcinoma, G for germ cell carcinoma, H for high level of HCG. Understand? Then calcitonin. Calcitonin is released from what? C cell of the thyroid gland. Thyroid. So C cell is present in which part of the thyroid? Medullary part. So medullary thyroid cancer is in that time the calcitonin tumor marker is increases. So very easy. Then catecholamine. Catecholamine is the hormone which is released from the adrenal gland, and adrenal gland as well as metabolic. We know inflammation topic. There is metabolism in the metabolism. In that time catecholamine also released. So that's why the pheochromocytoma, which is related to adrenal gland, and a neuroblastoma, which is also related to adrenal gland. These tumors are in that time catecholamine level is increases, and it is used as a biomarker of that tumor. Then we go towards the oncofetal antigen. Oncofetal antigen, it is an antigen variety of a tumor marker. Oncofetal antigen, that is AFP. AFP is two variety. One is you can understand by that oncofetal antigen is expression during fetal period. So it is having two types. We know in the during fetal period, we know one thing, that in fetal have the tendency to growth. So which hormone is required? That is growth hormone. You shall write in that way G for germ cell tumor, H for HCC, hepatocellular carcinoma. So in that way very easy you can understand that AFP is a tumor marker for germ cell tumor and the hepatocellular carcinoma. Now when it is important that AFP marker level is increases in this malignant case, but after that there is also three conditions, that is pregnancy, in physiological condition, hepatitis, also AFP level is increases. That is a additional point. Now carcinoembryo antigen. Carcinoembryo antigen, which is related to colon cancer and a pancreatic cancer. So you can remember by this, that is CEA, C for colon cancer, E for a pancreatic cancer, that is, and in the benign case, that is inflammatory bowel disease, that is IBD, hepatitis and bronchitis, also this CEA level also increases, because that is neuroendocrine cell. It is a very important, commonly asked in Viva. That is a lung cancer, small cell of a lung. That small cell of a lung are, when metastasis or malignant state, there is NSAE, neuron specific coordinates or urocaninates level increases, and you can remember all the neuroblastoma also in that case the NSAE level is increases. Now we go towards the CA type of biomarkers, that is CA 50.3, CA 125. This is important for ovarian cancer. CA 15.3, that is breast cancer. CA 19.9, that is pancreatic cancer. How can you remember? CA 9.9 is pancreatic. We know 9. Now mirror image of a 9 is P. So you can understand very well that CA 9.9 is responsible pancreatic cancer. Also extra colon cancer we can find. CA 72.4, that is stomach cancer. 27.29, that is mirror image of a 72, that is breast cancer. So these are the important carbohydrate antigen we discussed. Now what are the additional marker we should remember? That is S100. It is very importantly question asked nowadays, that S100 is a most sensitive marker for the melanoma. Melanoma means skin related malignancy. So melanoma having many multiple markers such as HMB45, that is HMB45, that is also a good marker for the melanoma, but this S100 is a very sensitive marker for the melanoma. Then schwannoma, you can understand by this that MSL, you can write that MSL. Then you can schwannoma, LDH. LDH is found in the lymphoma, dysgerminoma of a male. In male, that is a seminoma. In female, dysgerminoma. And Ewing carcinoma. What is Ewing sarcoma? That is bone swelling and weakness of the bone tumor is related as Ewing sarcoma, where LDH acts as a biomarker. So how can you remember? By what? L for lymphoma, D for dysgerminoma. In male case, that is a seminoma, and H for Huddy is a bone. Ewing sarcoma. So beta 2 microglobulin, that is 2M. So you can write MM for multiple myeloma. Important prognostic biomarker, that is beta 2 microglobulin for MM. CD99, that is MYC2, which is the important marker for Ewing sarcoma. We discussed before that Ewing sarcoma is what? It is a tumor of the bone, skeletal bone disorder, where the onion peels like appearance will be appear on the bone, and it becomes weak, and the osteoblastic periosteoblast becomes look like in the X-ray study look it like a onion peel. That's ALK marker, which is responsible for A for anaplastic T cell lymphoma, L for adenocarcinoma of lung, then K that is nothing but neuroblastoma in the infants. So these are the I discussed 20 mark basis of tumor markers. You can use as in your short note, and we have a bonus point, that is our question. Please go through this question and comment us in our comment box.